नमस्कार, येवकार तुमकां हब पॉडकास्ट कार्यावळीन. कालूच नॅशनल विमन्स डे जालो आनी जेन्ना आमी सेलेब्रेट करता नॅशनल विमन्स डे तेन्ना एक विचार आयलो की बायलां मदीं जे काळजाचे रिलेटेड दुयेंसां आसा ताजे विशीं थोडो आमी चर्चा करची. कारण अशें कळ्ळें की बायलांच्या आनी काळजाच्या दुयेंसां विशीं ज्यो गजाली आसा त्यो खुबशे फावटी इग्नोर जाता, कारण तांचे सोशल कंडिशनूच तशें आसता. कारण तांकां सोंसून घेवपाची खुबशी संवय आसता आनी ताका लागून इवेंच्युअली जेन्ना ती डॉक्टरा कडेन पावता तेन्ना खुबशी डॅमेज जाल्ली आसता.
In association with Manipal Hospital's Dona Paula.
आतां ह्या विशयाचेर उलोवपा खातीर आमचे मदीं आसा डॉक्टर ज्योती कुसनूर. शी इज इंटरनॅशनल कार्डियोलॉजिस्ट विथ मणिपाल हॉस्पिटल, दोना पावला. आणि वी आर शूटिंग दीस इन कोंकणी आणि इंग्लीश बोथ. सो मॅम, म्हाका एक सांगा की नंबर ऑफ what a heart related disease, heart attack was called as a man's disease or man's problem. आता बायलांकूय जावपा लागला.
True. It was for years, like the previous generations and all. It was always thought that heart attack only, it occurred in men. Only men died of heart attacks. This is, I'm talking about 50 years or 100 years ago. But today that is no longer true. In fact, heart disease is the number one killer among ladies also today. So because the lifespan is increasing and also when overall, I mean the diseases which used to kill ladies before, म्हणजे infections आणि maternity related and all, they sagle they have all been conquered. Okay, whatever has to be, the nutrition, this and deficiency diseases, all those things have been treated, and other also contagious diseases and all, we have been able to conquer those. So today the number of the ladies dying of heart disease is much more than the whatever was happening in the previous generation. It is a ladies disease as much as it is a man's disease today, and it is the number one cause of death in women who are above 50 years of age.
And anything special about women and heart diseases? Any notable things which highlights this correlation?
Khubshe differences asa among like how a man presents and how a woman presents with heart disease. So heart disease, ladies are usually up to the age of around 45. Ladies are traditional hormonal thodeshe this protection asta, but that protection is not an absolute protection. So that's why, see, previously, maybe some 50 years back or 100 years back, when the lifespan was less, people used to, otherwise also, like, there were reasons for which, like, they were not surviving beyond 45 or 50 years. So at that age, up to the age of 45, men have a higher chance of developing heart disease or dying of heart disease. Women below 45 mache kami asta. Okay, so that's why they used to, mistakenly they used to think that heart
it's
disease and blockage फक्त heart mennak jata. But so up to the age of 45 machi protection asta due to hormones, but again that is not an absolute protection. If ladies who have diabetes, and diabetes amche goan, it is growing by leaps and bounds. Diabetes ami, like, even 25-30 year old ladies sudha amka ata diabetes ache khubshe melta, which was not there previously due to lifestyle and lack of activity and wrong diet and the stress, today's stresses and lots of junk food and many factors. The risk हार्टाचे जे रिस्क फॅक्टर्स असता ते लेडीजान खुबशे असता बिफोर द एज ऑफ 45. So even though मातशे हॉर्मोन्साक लागून प्रोटेक्शन असता, बट इवन दॅट इज नॉट एन एब्सोल्यूट प्रोटेक्शन.
सिम्पटम्स कितें आसा? फॉर एक्झाम्पल सिम्पटम्स कशे कळपाचे? दादल्यान आसा तेच सिम्पटम्स आसता?
मातशे डिफरंट असता. लेडीजाक इतले टिपिकल चेस्ट पेन जायना. आमी दादल्यांक म्हणटा न्ही दॅट क्लासिकल इन द सेंटर ऑफ द चेस्ट खुबशे क्रशिंग सिवियर पेन, तशें युजली लेडीजाक दे जनरली डोंट प्रेजेंट विथ दॅट. A lot of ladies will just say की आमकां just jaw pain जाता आनी सद्दां जायना. It is only when I climb stairs नाजाल्यार हांव कितें काम करतना jaw pain. तांचे लेडीजाचे heart is a very internal structure. It is not like you touch and you get pain. It's not like skin की खंय तुमी touch करता, that the painful part is that. Heart is an internal structure. ताचे nervesाचे द सप्लाय इज डिफरंट फॉर डिफरंट पीपल आणि लेडीजाचे मातशे डिफरंट आसता आणि मेनाचे मातशे डिफरंट आसता. सो इन लेडीज द नर्व्स सप्लायींग द हार्ट are because of that they perceive it a little differently. And lots of few ladies only come with the typical severe chest pain. Many of them will have just jaw pain or shoulder pain, or lot of them will just think it is amaka acidity asa, amaka gas asa, amaka indigestion asa, or they just feel tired. So these could be the symptoms of heart disease in women. आणि ताका लागूनच diagnosis केन्ना miss जाता, because they think it is and they think it is some kind of muscular pain and all. So they go to other specialities where it is not picked up till an ECG is taken and all. It is not diagnosed that this acidity or gas, whatever the lady is thinking, is actually a cardiac problem.
Nausea जाता किंवा weakness जाता.
Nausea, lot of gastrointestinal symptoms आम्ही म्हणता नी, like that this thing they feel like vomiting, they feel very nauseous, आणि खूपशे acidity is one of the commonest words used by ladies who have when they have a cardiac issue. आणि gas, acidity, indigestion तशेंच दिसता तांकां. आणि मातशे जेन्ना तांकां आणि जेन्ना this is in the earlier stages, म्हणजे जेन्ना blockages बी जाता तेन्ना अशें दिसता. आणि when the lady develops a heart attack due to which मागीर pumping बी drop जाता, then very often they think it is just थंडी जाले, म्हाका थंडी जाले. The breathlessness which they feel, okay, due to जेन्ना हार्टाचे pumping drop जावन lungs भरून येता न्ही, many ladies are misdiagnosed as asthmatic attack. Okay, or थंडी जालेले आसा, or मातशे pneumonia जालेले आसा, when actually that whatever pneumonia, whatever asthma attack due to which the lady admit जालेले आसा हॉस्पिटलान, actually it is a cardiac episode. ते मागीर सगळे टेस्ट करून आणि ECG करून, इको करून आणि आमचे cardiac enzymes बी करता तेन्ना कळटा. Till then they think it was, many times it is misdiagnosed or underdiagnosed. ताका लागून ladies' outcomes also are poorer. See, if a man develops a heart attack versus a woman developing a heart attack in this country, the man will do better because तेजे diagnosis मातशे बेगीन जातले. He will go, he is likely to be taken to the hospital earlier. The symptoms are likely to be recognized earlier, आणि सगळे chain of events whatever we do in a heart attack starts earlier in a man. But जेन्ना lady तशे जाता, usually from the onset of symptoms till the time of diagnosis, already a lot of time has already gone, because they have all these atypical symptoms. The classic symptoms zaina, atypical symptoms zata. So many times they are diagnosed only after the pumping samke deon, and samke the pumping goes down to some 30%, and they think it is pneumonia, asthma, thandi, and tenna diagnosed zata. So already you have lost that time, between which from a strong heart it becomes a weak heart. So we can have days to weeks between the blocks appearing, causing a heart attack, and the heart weakening over a period of time because of lack of circulation, and the heart becomes weak and the pumping drops, and tenna lungs भरून येता.
So ignore करता, do they also ignore?
Yeah, ignore करता, आणि it is misdiagnosed also, and because the symptoms are not so typical, because the typical pain be zaina. And like the sad part of our country, and is that socially also ladies are आमी पळयलेले आसा, they are mainly the caregivers in the family. ते बाकी सगळ्यांचे केअर घेता, फूल फॅमिलीन त्यांच्या हजबंडाक खूब केअर घेता, त्यांचे भुरग्यांचे केअर घेता, त्यांचे ग्रँडचिल्ड्रनाक केअर घेता. बट वेन इट कम्स टू देअर ओन हेल्थ, they always they avoid coming to the hospital. Okay, husbandak every time आडटा, सगळे फॉलो अपाक हजबंडाक आडटा, बट जांकां तेन्ना सिम्पटम्स जाता, they are not willing to, नाका ECG नाका म्हाका, नाका कित्याक I don't think I need, बरें आसा हांव घरा वता, सारकें जाता तशें म्हणटा आमकां खूब लेडीज. आणि we have seen it happening. I can just give you one example. One, of course it's not a cardiac thing, but then I had one patient, this is about 10 years back, when I was like beginning my practice. Then एक lady, they were a 65-70 year old couple. Okay, so this lady was very very devoted to her husband. The husbandak attack zale आणि he became quite serious. तेका लागून that is when I came across them. So हांवें husbandak म्हाजे कडेन हाडलेले. I did an angioplasty for the husband. So husbandaचे pumping मातशें कमी आशिल्ले, some 30%, and he took some time for recovery. तेजे नंतर his wife had taken excellent care of him. Samke like one ICU nurse, tashe she has taken care of him and she brought him out of it. And she used to come for follow-up like 15 days, 20 days taka husbanda काढून आणि she used to come with one big chart ki BP इतले आसा, husbandaचे हे आसा, sugar इतले आशिल्ले and all. After some, in a month or two when I started seeing them, I just noticed that lady mache sangle. She was also like 65-ish. So I said ki madam mache तुम्ही सुद्धा बारीक झालेले दिसता, म्हणजे whatever I've seen you 2 months back, you're not looking your usual self, mache samke sankan आणि बारीक. She said like kai na and all. And then after some 1 month again they came for follow up. Again I told the same thing because she looked even worse than what she was during the some 3 months back when her husband got ill. So again I told ki like mache test करून घे तुमचे किदे आसा and all. And again she brushed it aside and again she had a big chart ki husbandache हे this thing list like BP so much at at 9 o'clock BP was so much, at 10 o'clock sugar was so much, and husband was doing quite well by that time, and it's already some 4-5 months since the husband's attack. After that for some 2-3 months I did not see them. Okay, this I'm telling you a true thing. This was it was in GMC. I was an honorary cardiologist that time in GMC. So 2-3 months I didn't see them at all. After that, for the first time, the husband he came alone. So I was surprised. I was like, wife khaya asa? I mean, I've never seen she was she never let him alone, left him alone at all. And he came and he was all sad. And I asked him, what happened to your wife? He's saying that no, she expired. And for me also it was a shock. I said, why? What happened? I had seen her getting thinner. Afterwards, finally, hospital and vele. Then she turned out to be last stage of cancer. She had a lymphoma. It was last stage, and she had not. That's what I'm just. This isn't just to tell you. It's a real true thing. See, this lady, she was getting thinner and she didn't, for her, it's her husband's, this was important. Was more important. Means she didn't even give a thought to that why she's getting thinner. And I was pointing out to it. It was like becoming obvious to me also that she's losing weight and, something is not right because I had seen them over a period of around 3 to 4 months now. So he had come very serious. Then she made him all right, but she lost her life in that process. So finally, when she was finally diagnosed, it was a end stage lymphoma which had spread everywhere, and finally he took her to Tata's, and it was too late at that time. But he lost her. In the sense this is how our society behaves and our tradition. It's the husband wife who always takes care of the husband, and husbands don't give that much attention to their wife's health. So probably he also brushed his she's looking after me, that's why she's losing weight. But then so little bit of attention if she had given to her own self. See, lymphoma is also a treatable condition. So this happened to me about 10 years back, but it's always there in my mind, that it has always stayed because it was an unnecessary for her also. It's just because this is how ladies ignore their health.
So physically, if we see any lady, for example, from a family, looking at them, can we diagnose that she has a heart?
No, heart disease are symptoms thode aslayar, then they need to go for further evaluation.
But the third person cannot look at her and diagnose.
No, heart disease, no. There are easy ways to diagnose. It's difficult na diagnose karpak. First, तुम्ही डॉक्टरा कडे वता तेन्ना डॉक्टर तुमका सिम्पटम्साचे विचारता. So usually symptoms will be की चलताना, steps चढताना खरज मारपाचे, steps चढताना कितें jaw pain जाल्यार, steps चढतानाच acidity जाल्यार, आणि बसल्यार when they sit or when they take rest, that symptom disappears. These can be heart symptoms. But heartaचे सोडून सुद्धा बाकी सुद्धा there are other conditions also when similar symptoms occur, but let the doctor decide. At least ECG तरी काढून पोवंक शकता की हार्टाचे आसा की हार्टाचे ना, इको काढून पोवंक शकता, ब्लडाचे टेस्ट करचे पडटा, तेजेर सुद्धा कळटा की तुम्ही ॲट रिस्क आसा की ॲट रिस्क ना. So people who are at risk, the ladies who are at risk are those who have diabetes or high blood pressure. हे असल्यार then हार्टाचे रिस्क वाडटा. हाय कोलेस्ट्रॉल असल्यार हार्टाचे रिस्क वाडटा, ब्लॉकेजाचे चान्सेस चड आसता. Similarly, those ladies who are smoking, smoking unfortunately is catching on in a big way with the younger generation, which is a sad thing. Okay, we see a lot. Yeah, it's very unfortunate. So ladies are, I don't think the girls in their 20s should remember that smoking doesn't liberate you. It actually you get jailed into.
You're trapped
into bad health. So again, another example. So there was this lady, this girl, I would say, just about a month back. Okay, so a 27-year-old. Okay, ti anga goen asa for the last 10 years. She's actually from Nepal. She has come to work in a casino around 10 years back in Goa. So पहिले एकटे येले, so she was just 18 years old. So when she came to Goa, there itself in Nepal, she used to smoke, but ek fauti Goan येल्यार she started smoking some 20-30 cigarettes a day. She used to have lots of alcohol, and about a month ago taka mache acidity symptoms तशे झालेले. She went to the nearest hospital, and she was just 27, so they said ki this is acidity, you're too young, like you're just 27, tumka kai jao heartache na. But it persisted and it got worse, like these khub it started increasing a lot. This thode suda moves alar, it was she was getting very, very uncomfortable. So finally some doctors suspected that maybe it is heart, and आमचेकडे इव्हॅल्युएशनाक लागून धाडले, and she had a 99% block in the main artery. So why I'm telling you is that, see, she's 27, taka hormonal protection asa, but then if she's smoking 15-20 cigarettes a day, te sagle hormonal protection vaita. So anybody who's a smoker, nothing else that you do will negate the the sin of smoking as far as the
should quit
heart
smoking,
is. Yeah, quit smoking. Yeah, so this girl had a 99% block. So in her case, it was entirely because of her bad habits, that whatever otherwise grandmother of 57 or 67 would have developed that 99% block, tika at 27 years of age zalele. So smoking has made her 30 years older.
Yeah,
so luckily she got diagnosed in time. Ami stent gatlele. She's doing fine now. And the same girl has a younger sister whom she again got from Nepal, and she also works in the casino. And this younger girl doesn't smoke, doesn't drink, and she's fine. So see, genetic hereditary components also are there, but lifestyle plays a big role in creating heart problems.
Yeah, also
it's a lifestyle disease.
But also it is genetics, like
genetic hereditary asta. Janka, see, there are some people in whom other people in the family. See, we always ask these questions. Tumche baki family members, tumche cousins and bikun sudden cardiac death zalele asa, otherwise sudden heart attack, konang angioplasty zalele asa, tumche cousin brothers, cousin sisters, are, because there are some families where through genetic means they have high cholesterol levels. Tenche the way they metabolize. See, cholesterol kashe jata, tumhi food whatever fatty component tumche food an astani, te tumche stomach like intestine digest करून ते मागीर तुमचे liver extract करता. Okay, so that liver extracts that fat and pushes it into the blood as cholesterol, as triglyceride. So this how much the liver extracts from your food and how much it throws into your circulation, into your blood, a lot of genetic component is there. Okay, so there are some people who are very lucky. Kitle fatty food खायला रोई, तांका cholesterol वाढना, तांका attack जावचे ना, तांका stroke जायना, but they are blessed, genetically blessed, की त्यांचे liver तशे आसा की it doesn't throw that doesn't extract cholesterol from your food and doesn't throw it into your blood. That is your good luck, that genetically you are protected. But on the other hand, there are people who are very unlucky. They third fatty food खायना जाल्यार सुद्धा their liver behaves in such a way that it extracts whatever fat it can get from the food, and it still increases the cholesterol level.
करता कि I am a very my lifestyle is good, I don't smoke.
Yes.
Still they have heart attack.
Yes, that's what. So these genetic factors asa. So that we cannot do anything about. See, but fortunately, God has genetic factors and uncontrollable factors are less. आम्ही जिथे control करूंक शकता, that is a big list. I mean, we can control our diet, our lifestyle, our exercise, आमचे weight, ते सगळे आम्ही control करूंक शकता. So genetic heart disease आम्ही म्हणता it's multifactorial. म्हणजे एक factor जायना. It is a combination of multiple things which go on to create
Amongst women, एक असता menopause, दुसरे असता hormonal changes आणि pregnancy. Are these three conditions responsible for weakening your heart?
Weakening, see, pregnancy specific heart disease मी म्हणता जाल्यार there is one condition called as peripartum cardiomyopathy. So it is rare, but it is there. Okay, so it's a rare condition where during pregnancy, okay, during the last stages, म्हणजे after 6 months of pregnancy, 6th, 7th, means 8th, 9th month of pregnancy, ते टायमान the heart suddenly becomes weak. Okay, so that is a specific to pregnancy. Peripartum cardiomyopathy is the name of the disease. Okay, but that time the lady can get breathless. Okay, and the heart pumping from 60 and above is normal pumping. Ejection fraction mantati, that should be above 60%. They suddenly drops down 20-25% जाऊंक शकता. So that is a medical emergency. Okay, that has to be treated in the hospital, and usually those ladies require very intensive therapy. And after the child is born also, like usually it takes about 3 or 4 months sometimes to settle down. Rarely it can be so severe that the lady can lose her life, and the pregnancy may have to be terminated much earlier during that. But it's a rare condition, peripartum cardiomyopathy. Tashe konang zalyar, by bad luck, if it has happened to someone, we generally tell them to avoid the next pregnancy, because there is something in the fetus which has triggered, which has attacked the heart. Okay, but this is a rare, luckily it's a rare condition. So apart from that, during pregnancy, other heart related conditions are that thode ladies palpitations bhi chad vadung shakta, because there are many hormones which are released during
also there is
pregnancy.
Anxiety also.
Yeah, anxiety is there, plus there are many other hormones which are released by the fetus, which can increase the heartbeat. Okay, and it is physiological many times, but then sometimes it can trigger this ectopic beats आम्ही म्हणटानी, and some ladies are very symptomatic, तांकां खूब अशे छाती धडधडटा आणि थोडे सुद्धा चलल्यार ताका खूब palpitations जाता. So but most of the time they can be managed without too much of this. Then other than that, there are another pregnancy related heart disease is that if somebody already has a pre-existing heart disease, okay, some like girl has been born with a hole in the heart and all, that girl later on, now ata itle ami technology and our medical science and cardiology has advanced a lot, so many children who are born with heart defects, holes in the heart or arteries are being abnormal, okay, many of them get treated in early childhood and they grow up to have normal normal life. So for a man it makes no difference, because he just has to do his work, but for a lady, for that same girl who was like born with a hole, when she's 25 or 30, it's quite possible that she might want to start a family. So that time things change again. So fortunately, many of these, like if it is a hole in the heart which has been closed, ASD, atrial septal defect, that's the commonest type of hole in the heart. Okay, so they ata close karta, and most of them are able to have normal pregnancies without any problem. But there are some conditions like blue babies mantani, cyanotic heart disease, people who are born with blue. So those girls, if they are not corrected in time, okay, and then they if they become pregnant, that is very dangerous, because the lady can lose her life, and also the child also is not likely to survive, because so anyone who has had any girl who has had any kind of heart disease, congenital by birth, so we always ask them ki before you conceive, please get a proper evaluation done to know whether you can carry the pregnancy or not. And most of the conditions are correctable also, but they should be corrected before pregnancy. Not like, after once they are pregnant, it's very difficult to manage the, pregnancy in an uncorrected heart disease. So that is one thing which I can give you examples. There are some, sometimes in amche country, in amche social, he asta ki, ki at least the girls' diseases are not revealed. to the boys side. Okay, so we have like I mean fortunately आता मातशें कमी आसा, but when I was a student in Goa Medical College before I became a cardiologist, okay, आमचे कडेन we used to have something, the rheumatic heart disease used to be there. I mean you would have heard, I'm sure rheumatic heart disease was very prevalent maybe about 15-20 years ago. Luckily आता मातशें कमी आसा because that is more related to poverty, infection and all. So आमचे कडेन we used to have these girls who are like 16, 17, 18-year-old जांकां valve tight आसताले. And their parents used to come and tell ki आता तेजे after like we are getting her married, we don't like we are not going to tell this to the boys side ki ताका हार्टाचे आसा मागीर तेजे marriage break जाता म्हणून. So that is a very dangerous thing. Okay, because not telling, because see these are correctable conditions. The heart valve they are correctable conditions, and if it is not revealed in time and if the lady becomes pregnant, she can lose her life. And then not only she loses her life, the child also unlikely that you're going to have a good this. So this is all part of our, I mean I'm telling our tradition. It's, our social structure is such ki girl kide heartache bhi problem aslar they many times the parents do not we do know that nobody is going to marry her if the boy's side knows that she has a heart problem, her marriage will break. So they used to keep it a secret, and then after pregnancy the girl is to come to us with a lot of problems. So that time it is very difficult to manage because you're two lives and very likely that you might lose both the lives. So that is one thing which we would like to tell. But I mean this is something which about maybe some 15-20 years back it was more. Probably I think in 2026 it should not happen. Should not happen that it should because pregnancy definitely imposes a lot of additional cardiac burden. So if the heart is good, kai problems auchina, and if something correctable is there in the heart, it should be corrected before the girl gets 5 pregnant.
Habits do you recommend to women so that they have a healthy heart? This
congenital hereditary te sagle we cannot do much about that, but to
5
prevent
normal, I'm talking about normal.
So I would ask them to like I this year's theme was give to gain. So I would for women's women's day theme, so I would ask the women to give more time and more attention त्यांचे health take care of exercising. So that we have seen आमचे ladies are many times, especially the homemakers and all, angioplasty नंतर आम्ही सांगता की तुम्ही चलूंक जाय so that you don't develop future blocks. चलूंक जाय, exercise करूंक जाय. And that lady comes and tells us की ना आम्ही किचनान इतले काम असता, दिसभर हांव रांदता, सगळे हांव करता, so I don't need any exercise. So that is the problem. म्हणजे see किचनान तुम्ही जितले किचनान तुम्ही कितले काम केल्यार see our recommendation is 4 kilometers of walking per day. So that you cannot do in the house. So but the lady is so reluctant to leave the house and go and she says I'm housework asa, that is enough for me. Housework is not enough because many times especially kitchen work is you're doing it when you're stationary. If you're cutting vegetables, if you're washing utensils, they usually आम्ही एकूच जागेर रावून करता. So that is not to be counted as exercise, and that is not a replacement for going out. So give time to yourself. See, your family will not starve if you're not cooking. There are so many other ways to for them to have for the other work
to
be done.
It doesn't take much time.
Yes, that's what. So give yourself at least half an hour, 45 minutes a day. Go outside, go for a walk. Focus on tumche fitness, tumche exercise. Then diet, be more careful about your diet. Junk food avoid karung jai, fatty food avoid karung jai. Focus on your weight. Waist circumference in ladies, amche Indian standards, it should not be more than 80 centimeters. So that is one thing which we see, that like a lot of ladies around their waist they put on weight. So this is all lack of fitness, lack of exercise, takalagun. So focus more on being fit, going outside the house, going for walks, eat healthy food, eat fruits, eat vegetables, and go for health checkups. That's another thing. Means like always regular, they don't prioritize their own health. It's always
So if someone walks in Manipal, for example, and he has no heart related issues, आनी म्हाका हार्ट चॅक करपाक विल यू लाफ एट हिम एंड से की कित्याक आयला काय म्हणून
नो आय डोंट थिंक इन टू वी शूड नॉट बी लाफिंग बिकॉज आतां हार्टाचे डिसीजाचे इन्सिडन्स इतले वाडलेले आसा
टू गो टू डॉक्टर्स ट्रेडिशनली कित्याक आयला रे म्हणजे ना दोतोर हांव बरो आसा तरी चॅक कर म्हटल्यार तो म्हणटा की बरो नाय तूं चल मातसो म्हणून
नो दॅट दिस नाव वी कॅनॉट ignore because we have the number of heart disease, the number of people with heart disease, number of heart attacks have increased exponentially in the community. आमचे गोंयान सुद्दां खूब increase जालेले आसा. Probably today's lifestyle and diet and the stress and the work related आणि not sleeping on time and too much of screen time. So many factors are there. So no age group is immune today from heart disease. But I would like to tell you that see the good thing is that heartache disease preventable also asa आणि if it is there if it is detected early samke curable suddha asta. Okay, we can avoid lots of deaths due to heart disease by diagnosing on time. So ladies ak sangta ki please focus on your health checkup, focus on your health, don't be always so concerned about with your family this thing. Tumhi sarke asल्यारूच तुमचे family, if you are healthy yourself, then you can take better care of your family if you yourself are healthy. सामके लास्ट स्टेज इन अटॅक जावचे नंतर हार्टाचे पंपिंग सामके डाऊन जावन मागीर हॉस्पिटलान देन यू आर ट्रबलिंग युअर फॅमिली इवन मोर एक्चुअली.
True. Okay, so rather than coming on time and getting checked. Anxiety asta पण it also affects your heart condition.
Yes, anxiety and ladies are आणि stress असता because many of working at home, working outside सगळे तांकां पोवचे पडटा. So anxiety does play a role. Anxiety, depression, they do play a role. आमचे Indian women one thing that is found as compared to heartache as compared to the Western women is amche heart rate chad asta. See, our resting heart rate for a lady in Indian lady is almost 10 to 15 beats more than a Western lady of the same age. Okay, so that probably our आम्ही म्हणटा की आमचे sympathetic nervous system म्हणजे our stress hormone levels are more than what a Western woman of the same age experiences. So that also plays a role in creating heart disease in Indian women. So having high heart.
What do you recommend as a stress management for women?
Yeah, so focus on your own health and don't like for ladies especially don't try to be super women all the time. So it is okay if some work is left undone and all. Focus on your own self. Okay, so don't think that you're a failure if you're not able to your child's uniform is not the cleanest and your house is not the cleanest and that take care of your own self. Okay,
first
that should
take
be the
care
first,
of you.
yes, yeah.
Then you can think about others.
Yes.
Thank you very much,
yes.
doctor, for spending time.
Yeah.
And this is a valuable information on International Women's Day. कारण खूपशा फावटी we might celebrate women, but also to protect them from heart diseases is also a priority.
Yes. A strong and healthy lady only makes a healthy country.
Yes, true, so true. Okay, देव बरें करूं. सो हे आशिल्ली डॉक्टर ज्योती कुसनूर, इंटरव्हेन्शनल कार्डियोलॉजिस्ट, मणिपाल हॉस्पिटल. आनी कितें इन्फॉर्मेशन जाय जाल्यार यू कॅन ऑलवेज विजीट हर इन मणिपाल हॉस्पिटल बेस्ट but with prior appointments you can go there and meet her. And if there are any more questions or you fear की आपल्याक बाबा हार्ट रिलेटेड डिसीज आसा काय ना हें जर जाणा जावन घेवपाक जाल्यार तुमी मणिपाल हॉस्पिटलांत वचपाक शकता. यू आर वॉचिंग हब पॉडकास्ट ऑन योर फेवरेट चॅनल गोवा न्यूज हब. कीप वॉचिंग अस.